Good day, everyone. My name is Jovi Satoheto, caregiver of Sasin Iloilo Batch 2, and today I will be performing a turn demonstration on how to assess range of motion in the patient. Range of motion exercises that are performed by patient himself or by a nurse in case of helpless patient to mobilize all joint through their fall range. There are two types range of motion. First, active, done by patient himself. Second, passive, done with help of assistance from another person. And then we have the purposes of the range of motion: to increase muscle strength and endurance, to maintain normal physiological function, to prevent complication caused by immobility like contractures, to improve patient participation in activities of daily living, to improve physical activities, to increase joint flexibility. I will lock the door, fix the curtains for the patient privacy, and I will wash my hands to prevent microorganisms and infections. And I will introduce myself to my patient and explain the procedure using the two identifiers. Hello ma'am, good morning. I'm Jovi Satoheto, your healthcare provider for today. May I see your wristband please? Can you tell me your full name ma'am? And how are you today, ma'am? Okay, thank you. And today I will be going to assess you to perform range of motion exercises. Start providing range of motion from head to downward. Move head through flexion, extension, lateral rotation, hyperextension. Movement of head is contraindicated is supine surgery, spine trauma, and patient having central vein line. Flexion, extension, hyperextension, rotation, lateral flexion. Okay, ma'am, I will start your shoulder exercise now. Flexion and extension, hyperextension, abduction, adduction, circumduction, external rotation, internal rotation. Shoulders should be supported proximally and distally. Flexion, extension. Flexion, extension of the upper arm. Now I'm going to do the abduction, adduction. Abduction, adduction. Next, I'm going to do the elbow rotation. Outward rotation, inward rotation. Outward rotation, inward rotation. Next, your elbow. Flexion, extension. Flexion, extension. Also the supination, pronation. Supination, pronation. Then I will do the rest hand. Flexion, extension, hyperextension. Flexion, extension, hyperextension. Now I will turn your hands. Radial flexion, ulnar flexion. Radial flexion, ulnar flexion. Now I will work the thumb. Abduction, adduction. Abduction, adduction. Flexion, extension. Flexion, extension. Do the opposite of the little finger. Now I will work your fingers. Abduction, adduction. Abduction, adduction. I will work the finger individually. Then I will do the flexion, extension. Flexion, extension of the finger. Okay, ma'am, are you ready to work your leg now? Okay, I will going to expose only one leg. Now I will start working the hip. Flexion, extension. Flexion, extension. abduction, adduction, abduction, adduction. Outward rotation, inward rotation, outward rotation, inward rotation. Next, I will work the knee. Flexion, extension, flexion, extension. Next, I will move the ankle. Plantar flexion, dorsiflexion, plantar flexion, dorsal flexion. Inward rotation, outward rotation, inward rotation, outward rotation. Next, I'm going work the toes. Abduction, adduction, abduction, adduction. Working each toe individually. Next, I will do the flexion, extension, flexion, extension. So, ma'am, I'm done with your range of motion exercise. Once again, thank you for your cooperation. I will wash my hands. For my documentation, I will document the date, the time of the range of motion exercise.